So this graph shows us the total confirmed deaths from COVID-19, and we see there's been a dramatic increase in the number because we are in a COVID-19 pandemic. Now, what's going to happen to the shape of this curve in future? Of course, we don't know. But unfortunately, I suspect it's going to go on increasing. The number of global deaths is going to go on increasing for some time, I'm afraid. Now, it will vary from place to place. Some places are going to be more severely affected than others, and other places are going to be affected in a fairly mild way, which is encouraging. But globally, I think the numbers are going to increase. So it is Wednesday, the 29th of April, and this is the update on COVID-19. Thank you for coming back, as always. Now, I've had quite a few emails and messages from parents who are alarmed about parents and other people as well, but they're alarmed about this illness that's been talked about in children, this new severe mystery illness in children. So what is this? Do we need to worry about it? Let's try and look at a little bit of detail. Now, having said that, I can't find any published scientific papers on it yet. So this has come from NHS circulars, where NHS officials have circulated information to general practitioners and nurse practitioners about looking out for this new illness in children. So what do we know about it? And the answer is it's limited at the moment, but let's check it out. So there's this new illness. It's an inflammatory illness in children. Now, cases are being reported from the UK. And there's been about 20 cases reported in the UK. Now, having said this, it does happen from time to time that new diseases do seem to emerge. And very often, I mean, one paediatrician, for example, might only see one in his career, her career. GP might never see a case, or very few GPs might see a case. But because of the way the data is reported now, the NHS, the National Health Service, is fairly joined up, and these things do start to emerge. And looking back in all other sophisticated health services like Spain, Italy and Ireland, cases have also been identified. So we're talking about, and we don't know for sure, about 20 cases in the UK. So the first thing to say is that so far this appears to be remarkably rare. 20 cases in the country. Now, the features are abdominal pain. There can be fitting, seizures, and rashes. So this appears to be due to an overactivity of the immune system. Now, quite why that is, we're not sure at the moment, because some cases seem to be associated with COVID-19 while others don't. But I think what we can say is at the moment is for parents, if children have unusual abdominal pain, obviously if they have fits, or if they have any unusual rashes, then of course seek medical advice. Call 111 if you're in the UK, or wherever advice line you've got. So have a high index of suspicion for abdominal pain. New fits, of course, all parents would already have a high index of suspicion, and rashes. And just talk it over with a healthcare provider to put your mind at ease. And in the vast majority of cases, your mind will be put at ease, because there's only been 20 cases in the UK, which is a small amount, but still, of course, very concerning because we're talking about children here. Now, the reason that this is potentially a bad disease is that there can be inflammation of the blood vessels and the heart. And we do know that in London, quite a few children have been admitted to intensive care, but as we say, not more than 20 in the UK. Now, some of the children with this new inflammatory syndrome, which really hasn't got a name yet, tested positive for COVID-19. So some tested positive and some didn't. So whether this is related to COVID-19 or not, it's hard to be sure yet. Now, if it's not, it's a bit of a coincidence that it arose in Spain, Italy and Ireland at the same time as the COVID-19 pandemic. So it looks like it probably is. But we don't know yet for sure. Now, this is Professor Russell Viner, who's head of the Paediatric Association of some sort. Anyway, one of the most senior paediatricians in the country. And I'll put the news outlet link on for you to read this yourself. So this is Professor Viner. I suspect that it's incredibly unlikely that we are talking about a new strain of the virus which targets children. So quite a relief there when I read what Professor Viner had said on that. So it looks like this is not a new nasty mutated strain that's attacking children rather than having greater morbidity and mortality in older people. It looks like it's not that. And we do know from many other studies that while this virus is mutating, of course, all RNA viruses mutate, they keep changing, but it looks like it's not mutating quickly or dramatically, which again is encouraging, because this means that one vaccine is probably going to work for the world. And good news on vaccines later on in this video today. Now, I've just came across some information from Taiwan recently, so I thought I'd share it with you. Now, Taiwan suffered very badly in the 2002-2003 SARS-1, Severe Acute Respiratory Syndrome 1. It's not a pandemic, it was arrested before it got to that stage, but Taiwan, I think there was about 79 deaths in Taiwan from that. So they had a high awareness of the possibility of viruses coming. And indeed, it has to be said, in Taiwan, they have a high awareness of viruses coming from China. But in the current COVID-19, they've had 429 cases and 6 deaths. Quite remarkable. So where did they go right and where did the rest of us go wrong? Well, the answer is that they took the first measures in 2019 on the 31st of December and established a central command centre with huge powers on the 20th of January. In other words, they were proactive, not reactive. And if you remember watching my videos in January, February, we used to use this quite a bit when we were warning what was happening. So on this video, and many other people were warning what was happening, but governments weren't listening. And we came up with this reliable saying, we need to move from reactivity to proactivity. It's a pity more governments didn't do that, because now it's much harder to control. If only we'd moved earlier. If only this had been listened to earlier. Anyway, we are where we are at. No point going over that too much. Now, in the United States, I'll just show you, I think I'm going to show you another graph here, actually. This World Data site is really quite incredible. So here we have total COVID-19 deaths and how rapidly are they increasing. Now, always look at the scale. This is a logarithmic scale. 0 to 10, 10 to 100, 100 to 1,000, 1,000 to 10,000, and that's 10,000 to 100,000 up there, I'm afraid. So we can see that looking at the United States here, it's gone up really quite dramatically. Now this line here would be doubling every 2 days. This would be doubling every 5 days. So unfortunately, we're still seeing doubling in the United States about every 4 days. So that's really quite a dramatic increase. Canada, now remember from there to there, so that is 10 times less, isn't it? Because it's a logarithmic scale. So Canada, it's about 10 times less, and Mexico's behind that. But I wanted to focus on Mexico today because things are increasing in Mexico. Now, hopefully this curve in the United States is going to completely level off now, but I do fear it will carry on rising, at least somewhat. And likewise for Canada, I think there will be some increase as well in Canada. But we're going to focus a little bit on Mexico today. So, but before we do that, let's carry on with considering the United States. Now, the United States, we know the cases have been over 1 million for some time because we know it's underreported, but still quite sobering, really. Well, to be quite honest, it's quite emotional to see the figure past 1 million there. So a lot of cases in the United States and deaths in the United States now above 58,000. And news outlets have been making comparisons between this number of deaths and other tragic deaths in the United States, but I'm not going to go there. Let's just notice at the moment there's 58,000 more deaths in the United States, and that is going to increase. This is a terrible disaster. Now, Dr. Fauci was saying it's inevitable the virus will return. Now, to be quite honest, it hasn't gone away. It's still here, and we'll be looking at reasons why this virus is going to stay in the United States. Unfortunately, I believe, until we get a vaccine. But what he was talking about there, what I think he was thinking about there, was a second wave. So it's bad that this virus is going to have these effects over the summer, which it will do. But it's really quite frightening to think that the virus will still be here next autumn and winter when we go into the next influenza season. Because we know that when people get influenza and COVID-19 together, as many inevitably will, it has a much more severe prognosis. Now, the president has mandated meat plants to stay open. Now, why there's been so many outbreaks in meat plants in the States, I don't know. I do hope the occupational experts are looking into that, because it looks like meat packing workers are a significant risk. So that's really very concerning. And do they work in particularly close quarters? I really don't know what it is. Are the plants particularly poorly ventilated? It would certainly be good to have the plants very well ventilated. In fact, every public place needs to be well ventilated. This is a big thing we're not doing right. We're not ventilating public spaces enough at the moment. This, as you know, is an apolitical broadcast video, whatever you want to call it. And now a lot of people feeding back to me do believe they've detected I'm to the far right or the far left or the far middle or somewhere. But believe me, I do try and make this apolitical. But for a leading member of the United States public to be seen in public not wearing a mask, to me, is just nothing short of disgraceful. All the people around Mike Pence were wearing a mask, but Mike decided not to wear one. What kind of message is that giving out, really? And so this is not, I'm not saying this because he's a politician, I'm saying this purely because Mike is a well-known figure, and well-known figures must set an example, in my view. Mike obviously doesn't, I don't know what he thinks. So wear a mask in public places, please, because you may be spreading it. Now, in his defence, Mike says that he's been tested a few times and he hasn't got it. But of course, he could have caught it without knowing it since his last test. And apart from that, we really need to follow, leaders need to set a good example. So I would suggest that if Mike's listening, he starts wearing a mask. His choice, but that's what I would suggest. Now, some limited progressive reopening, Tennessee, South Carolina, Mississippi. And there's a lot of provisos about that. Some things are opening, some things aren't. So it is being done in a thoughtful way. But as long as the governors of those states realise that the more reopening there is, the more cases there will be. It's their choice, but as I understand the science, the more reopening there is, the more cases there will be. I understand the need for reopening, but that is the simple science of the matter. I can't really change that. And quite a few places like Iowa are opening up now, but with 50% capacity. Now, the thing is, there's a lot of travel within the United States. So really, you know, our health depends on everyone else is one of those reliable sayings we had before. So, you know, if one state manages to eradicate the virus and the one next door doesn't, that's kind of, it's a bit awkward really, isn't it? So our health depends on the person immediately next door to us, but it also depends on the person on the next state because our health depends on everyone else. And the other reliable saying that we used in this video was this one: healthcare must be of the people, by the people, for the people. So this needs to be something that everyone is doing. It's got to be by the people, but it's for the people. So I just feel we need collective action. Countries need to move forward together on this. Now, I haven't done a report on Mexico before. That's partly why I showed that graphic. But I'm reporting on it because I'm very concerned about it. Now, the number of cases aren't massive, but the deaths are increasing. But this is a country of 128 million people. And I've just found out, someone wrote in saying that the Ministry of Health said that up to 80% of the population can be have high blood pressure. Depends on the criteria that you use for high blood pressure, for hypertensive. But peer-reviewed literature, and I've put a link to this from a peer-reviewed journal, 25% of the people in Mexico have a higher blood pressure than is probably good for them. So there's obviously many degrees of hypertension, and how you define it varies quite a lot. I normally define it as over 140 systolic or over 90 diastolic, but there's many definitions of it. But basically, for good health, you want your blood pressure to be lower rather than higher. But many people in Mexico are hypertensive. Obesity is prevalent, as is diabetes. And of course, we know that all these are big risk factors. Probably roughly in that order, actually. So big risk factors here for more serious disease in many of the people in the population in Mexico. So it looks like these high prevalence of these pre-existing conditions could increase the case fatality rate in Mexico. Economically, 60% of people work informally. There's large slum areas where people are going to be close together. Apparently about 25% of this is just a Wikipedia check, but 25% live in Mexico City. So again, close together. Bad memories like New York come to mind. And unfortunately, Mexico City could well go the same way. Apparently, people weren't obeying the restrictions on Easter celebrations. In Mexican culture, Easter's a bit of a let your hair down time, I believe. So there was social distancing wasn't respected. I've been told there's a lack of national awareness. Apparently there's atypical cases of pneumonia reported, and we know from World in data that the deaths have doubled in the last 7 days. So really quite concerned about Mexico for all of those reasons. Now, just a quick review of Africa. Africa's not testing enough. So Tanzania's got 306 cases. We know it's more. 10 deaths, but the deaths have doubled in the last 7 days. And similar for Somalia, again, lack of testing, but even small number of deaths have still doubled in the last 6 days. So probably the first thing that countries like Tanzania and Somalia will know, the first indication that they will know that they have greatly increased numbers of COVID-19 community transmission in their countries, will be the increase of deaths. Because there's not enough monitoring of symptoms, and there's not enough testing, certainly not enough testing. So unfortunately, I think we will see the deaths increase, and that will be the tragic indicator as deaths increase that the number of cases had increased in the weeks before, because we know of the lag. Now, Japan is a mystery case. Why Japan hasn't got its act together, I don't really know. Cases are increasing, deaths are increasing, and deaths have doubled in the last 6 days in Japan. So I would expect that to probably happen again. But this is based on minimal testing in Japan, which is just amazing. I really don't know why Japan has not got massive testing in place. It's known about this for a long, long time, and it just doesn't seem to have come together in Japan. So don't pretend to understand, but that's the data I have. Now, the UK. The UK is changing the way it reports deaths today. These are deaths in hospital, but it's changing to report deaths in nursing homes as well. So, unfortunately, I'm expecting this figure to go up to about 30,000 today, if the combined number of deaths is taken. 43,000 tests performed in the past 24 hours. I checked on the UK site. But the UK's got capacity for more, so there's been logistical problems. So what's happening now is they're sending tests directly to nursing homes where they're particularly needed at the moment. And the plan is in the UK to test 25 million people. So let's hope that happens sooner rather than later. At the moment, the testing is very low for an advanced country, 8.39 tests per 1,000 people. So hopefully that will start progressing. Now, this is very, very, very encouraging. The Oxford vaccine. Now, the Oxford University and associated groups, what happened here was that they started working on coronavirus vaccines quite some years ago. Because, of course, with coronaviruses in animals, I'm pretty sure there's coronavirus vaccines for cats that vets are giving out. And, of course, there was the coronavirus in 2002, 2003, and there was the MERS, the Middle East Respiratory Syndrome, 2011, 2012, I think that was. So coronaviruses have been known to be a problem. So this Oxford group is already working on coronaviruses. So they've been able to take the work that they've got and they've been able to transpose that into this new novel coronavirus. So this seems to mean that they are the world's most advanced group and they are making very promising noises. Now, these scientists do tend to be very conservative people. And if they're making promising noises, I'm encouraged. So it could well be that this is the world's first vaccine. Let's hope so. Well, no, I couldn't care less who's the first vaccine. Let's hope it comes out sooner rather than later is what I mean. So the vaccine's adjusted from previous coronavirus vaccines. So they've got a head start, in other words. Now, manufacturing capacity is being put into place as we speak in the UK and the US. So as soon as the scientists give the vaccine to the manufacturers, they'll be off like a shot. So that is encouraging that there should be massive vaccine production as soon as the scientists work out how to make the thing. Hundreds of millions doses needed and planned. So that's good. Now, I've been showing you this app that a lot of you don't like. Some of you do, but I've been using it. So COVID Symptom Tracker app. Again, I think it's another Oxford group. Oxford seems to be doing very well at the moment, Oxford academics. Now, the predicted symptomatic people today, according to this Oxford group, is they think that probably 300,000 people or more are symptomatic. So what this means is the official number of cases in the UK was, what was it? Can't find it just now. Anyway, the official number in the official number of cases in the UK is way lower than the actual number because they're predicting that many people are symptomatic today. Now, if that's the case, it probably means that a couple of million people have actually had it, or 2.5 million people have had it. So we could be looking at perhaps 2% of the population of the UK that's already been infected, maybe 3 or 4%, we're not really sure. But they're the predicted number of people that are symptomatic today, according to this COVID Symptom Tracker app. And this is based on data that's reported daily from 2.7 million people. 2.7 million. So it's a good size sample. So this is good research. Now, the good thing about this is it means that quite a few people have had the condition already and have recovered. And the NHS has, on the whole, been able to cope. The bad news is it means that these people have been infectious for 3 days already when they get the first symptoms and will still be infectious for 7 or 8 days. And I was talking to a colleague recently who tested positive after a month after they presented with symptoms. So most people we believe can spread the virus from about 3 days before they become symptomatic to 7 or 8 days after they become symptomatic. But it looks like the odd person keeps having the virus or positive virus tests for some time, in this case a month. And we know that people that are still symptomatic should consider themselves to be infectious. So that means there's still a lot of infected people in the UK. That's the downside to that. Now, they've been looking at data from twins because genetics is important in symptom development. Now, this app has taken 2,633 twins, so that's quite a lot. Now, I'm not quite sure if this is based on UK data or whether this includes US or not as well. It doesn't matter too much because it's 2,633 sets of twins, so that's like, well over 5,000 individuals, isn't it? And from the twins, and they've combined this to some extent with data from twin studies, because with twins, you can learn all sorts from twins. I mean, twins are just absolutely brilliant. So there's two sorts of twins, as you probably know. There's identical twins, which are called monozygotic twins. They come from a single zygote, one sperm and one egg. And they are genetically, essentially identical. They are clones of each other. And then there's familiar twins or non-identical twins, which are called dizygotic twins. So what happens in that case is mum releases 2 ovum at the same time and they get fertilised by 2 sperms. So they only share 50% of their genetic material as any siblings would. But of course they're sharing an environment, so there's all sorts of things you can learn from twins. Absolutely fascinating studies from twins. So what's happened here is, looking at twins, they've come up with some provisional data. And this is by very skilled analysts. So there's no reason to suspect this is wrong. So why is it? We haven't known this, you see. This is a really powerful point. So why is it that 2 people get COVID-19? One is asymptomatic or has very mild illness, and one gets really sick and goes to intensive care, and tragically some of those even die. What is it makes the difference? Well, we know about the comorbidities and we know about the increasing age, but we still hear about tragic cases of young people that are dying. So what is it that's determining it that we don't know? And what this group is saying is they think 50% of the reason why people get symptoms or not is genetic. So 50% of it is genetic. So does my genetics predispose me to mild disease, asymptomatic disease? Does it predispose me to severe disease and death? At the moment, we don't know. But they're doing studies to try and find that out. So that's very encouraging. Now, the other thing they've come across from this twin study is the amount of viral exposure. So this is a little, it's interesting. I mean, I've heard microbiologists saying that it doesn't matter too much how much virus you're exposed to, but it seems that it does. So people exposed to high doses of virus are going to get more severe symptoms than people exposed to lower doses of virus, it appears. And this is why it's so important to wear a mask. Because if someone's wearing a mask and the person next to them gets 100 viral particles, that's better than the person breathing or coughing over them where they get 100 million viral particles. So it looks like the amount of viruses that someone's infected with is a problem. Now, the comorbidities, we've done many times on this, we know about that. And environment and lifestyle is also a factor. So a lot of interesting points coming out of that there. Now, I've had some uploading problems, I'm afraid, in my video, so I'm going to stop that one there, I think. Put that one up, and then we'll come back and finish off. And I've got some viewers' pictures, some wonderful pictures to show you as well next time.